a continuation of my topic on sulfonamide. In my last lecture, I had explained how oral sulfonamides that are unabsorbed in the GI tract are useful for the treatment of inflammatory bowel disease such as ulcerative colitis and Crohn's disease. In this session, I will be talking about the topical sulfonamide agents. The three most important topical sulfonamide agents are sulfacetamide, sodium, silver sulfadiazine, and the third one is Mafenide. So speaking of sulfacetamide sodium, it has applications in ophthalmic infections and dermatologic infections. So how does sulfacetamide act? Now sulfacetamide acts as a bacteriostatic agent. Like most sulfonamides, which are synthetic bacteriostatic agents, and they are effective against wide range of gram-positive organisms and many of the gram-negative organisms. So this is the figure that shows the folic acid synthesis by bacteria, and the crucial enzyme that is responsible for folic acid synthesis is dihydroperoic acid synthase. So this is the crucial enzyme that utilizes para-aminobenzoic acid or PABA. So PABA is utilized for the formation of folic acid, and this is an important component of RNA synthesis, DNA synthesis, protein synthesis, which in turn is required for growth, multiplication of bacteria. So sulfacetamide acts by inhibiting dihydroperoic acid synthase, decreasing or inhibiting the folic acid synthesis which is required for growth and multiplication of bacteria, and thereby helps to treat infections by inhibiting the multiplication of bacteria and acting as a bacteriostatic agent, acting against many of the gram-negative organisms, and most of the gram-positive organisms are inhibited by sulfacetamide. Now coming to the uses of sulfacetamide, it is commonly used for treating ophthalmic infections and dermatologic infections. In ophthalmic infections, it is commonly used for the treatment of trachoma, which is caused by Chlamydia trachomatis. Secondly, it is also used for the treatment of bacterial infections of the eye, that is bacterial conjunctivitis, that is infection and inflammation of the conjunctiva causing redness of the eye. So it treats bacterial conjunctivitis by inhibiting the growth and multiplication of many of the gram-negative and gram-positive bacteria. Next, we move on to dermatologic uses of sulfacetamide sodium. Now, sulfacetamide sodium is available as a combination of sulfacetamide and sulfur. It is widely used for the treatment of acne vulgaris. So in acne vulgaris, sulfacetamide is used in combination with sulfur. Sulfacetamide has antimicrobial action. It inhibits the growth and multiplication of the microbes, so it has antimicrobial action. And sulfur acts as a keratolytic agent. So by acting as a keratolytic agent, they remove the dead cells and prevent clogging of pores. They can also absorb the oil of the skin and prevents the formation of acne, prevents the acne formation and treats acne. So sulfacetamide and sulfur combination is available in various formulations such as cleanser, facial mask, topical suspension solution which can be applied on the skin, and this helps to control acne formation and is useful for the treatment of acne vulgaris. So amongst the dermatologic infections, it is approved for the treatment of seborrheic dermatitis, which commonly affects the scalp, but it can also affect other areas of the skin. Now it is characterized by scaly patches, flaky patches, redness, itching of the skin, and this is a condition known as seborrheic dermatitis. So the next topical sulfonamide agent is silver sulfadiazine. Now silver sulfadiazine combines the antimicrobial properties of silver and sulfadiazine. It contains silver which binds to the components of the bacterial cells such as the DNA and the enzymes. So by binding to the DNA and the enzymes, it inhibits cell division, it causes enzyme inactivation, causes disruption of the cell membrane and death of bacteria. Sulfadiazine has antibacterial property. It inhibits or it impairs the bacterial replication, the bacterial multiplication and growth is inhibited, and thereby a combination of silver sulfadiazine is useful for treating burn wounds. So similar to sulfonamides, they are effective in inhibiting the gram-positive organisms and many of the gram-negative organisms, including Pseudomonas. So Pseudomonas is the causative organism that is present in many burn wounds. So it is useful for treating burn wounds because of its activity against Pseudomonas organism, which is resistant against many of the antibiotics. Therefore, silver sulfadiazine, by combining the properties of silver sulfadiazine, the sulfonamide property of inhibiting the Pseudomonas organism, it is useful for the treating burn wounds, treating second to third degree burn wounds where Pseudomonas is the positive organism, and also many of the gram-negative bacteria are inhibited by silver sulfadiazine. So the next drug is a sulfonamide analog that is also useful for the treatment of burn wound infections, particularly the second and third degree burn wound infections. So since it is a sulfonamide analog, it inhibits many of the gram-positive and gram-negative bacteria, but it is particularly effective against Pseudomonas and Clostridia. Now these two organisms are not commonly affected by sulfonamides. So silver sulfadiazine and Mafenide produce action against Pseudomonas, Clostridia. These are some of the resistant microorganisms, and by inhibiting Pseudomonas and Clostridia, which is the causative organism, which is the common organism that is present in burn infections, so silver sulfadiazine and Mafenide are useful for the treatment of second to third degree burn wound infections. Now, one of the advantages of Mafenide is that it is active in presence of pus. So also in presence of pus, Mafenide action is not inhibited. It acts even in the presence of pus, and also it is effective against many of the gram-negative bacteria, including Pseudomonas and Clostridia. However, the use of Mafenide has certain limitations. So let's see what are the disadvantages of Mafenide use. Now, Mafenide causes pain and irritation to the site of application. So the patient can experience an unpleasant sensation during application on the skin, on the burn wound, and this can be a common complaint of the patient. The second disadvantage is that it is an inhibitor of carbonic anhydrase enzyme. So carbonic anhydrase enzyme is inhibited, so this causes increased excretion of bicarbonate in urine, leading to metabolic acidosis. So metabolic acid is a side effect of Mafenide, which limits the use of Mafenide use because Mafenide is known to cause metabolic acidosis due to its inhibition of carbonic anhydrase enzyme. The third disadvantage of Mafenide is that long-term use of Mafenide can lead to secondary infections, including fungal infections. Lastly, allergic reactions can occur since it is a sulfonamide derivative. Now let's discuss the adverse effects of sulfonamides. Sulfonamides can cause crystalluria or renal toxicity. This is because sulfonamide is metabolized by acetylation, and the acetylated metabolite is less soluble in urine which is acidic. So acetylated metabolite is less soluble in acidic urine. This causes precipitation of sulfonamides in the kidney tubules, leading to obstruction of the kidney. So kidney obstruction, interstitial nephritis can occur with the use of sulfonamides in presence of acidic urine. So this risk can be minimized by adequate water intake and also by making the urine more alkaline. So crystalluria occurs in presence of acidic urine due to the precipitation of its metabolite, which is less soluble in urine. The second adverse effect is hypersensitivity reactions. Now, most of the sulfur drugs are associated with hypersensitivity reaction. This can range from pruritus, rash to serious reactions such as Stevens-Johnson syndrome, which affects the skin, mucous membrane. It can cause ulcerations in the mouth, in the genitals, and this is an emergency condition. So Stevens-Johnson syndrome or toxic epidermal necrosis could be a complication of sulfur drugs or sulfonamide. So, sulfur drugs are known to cause hypersensitivity reactions. Now, another limitation of sulfonamide is that it can cause kernicterus. Now, in kernicterus is neonatal jaundice where bilirubin gets deposited in the basal ganglia and subthalamic nucleus. This is commonly seen in neonates because the blood-brain barrier is not developed properly, it is immature. So sulfonamide, because of its property to displace bilirubin from the binding sites of plasma protein, so there is more of unconjugated bilirubin in the plasma, and the unconjugated bilirubin can easily pass through the blood-brain barrier and get deposited in the basal ganglia in the subthalamic nucleus, causing kernicterus. So kernicterus occurs because of the property of sulfonamide to displace bilirubin from the plasma protein binding sites, increasing the concentration of unconjugated bilirubin, which readily passes through the blood-brain barrier of the babies, of the neonates, and this gets deposited in the basal ganglia and the subthalamic nucleus, leading to kernicterus. Lastly, hemolytic anemia can also be a rare complication of sulfonamide use. So, hemolytic anemia can also be a possibility with the use of sulfonamides. So, in summary, we have discussed three topical sulfonamide agents, that is sulfacetamide, sodium, silver sulfadiazine and mafenide. Silver sulfadiazine and mafenide are widely used for the treatment of burn wound infections because of its particular and specific action against pseudomonas and clostridia, along with many of the gram-negative bacteria and gram-positive bacteria. Sulfacetamide sodium has both ophthalmic and dermatologic uses. In ophthalmic uses, it is commonly used for the treatment of trachoma, which is caused by Chlamydia trachomatis. And also it can be used for the treatment of bacterial conjunctivitis because it is effective against many of the gram-negative bacteria. In dermatologic uses, it is approved for the treatment of acne vulgaris and seborrheic dermatitis. So with this, we come to the end of the topic. If you find my video useful, please like and subscribe to this channel. Thank you for watching.